Good evening and a very warm welcome to everyone. I am Neetu Abraham, Community Manager at MediSage eLearning, a platform by the doctors for the doctors, created to foster continuous knowledge sharing, meaningful learning, and professional collaboration. On behalf of MediSage, I am delighted to welcome you all to Sexual Health Ki Pathshala to SexMed Connect, where today we will be discussing on the topic psychology of love and intimacy. With this, I would like to hand over the session to Dr. Shama Sultana. Over to you, ma'am.
Thank you, Neetu. So I welcome you all to SexMed Connect Sexual Health Ki Pathshala episode 4 with the topic Psychology of Love and Intimacy by our expert speaker Dr. Manoj Pandey sir. So SexMed Connect, it's a gynec forum for learning and discussing sexual health topics. We have various sexual health topics to discuss here, and we have social media platforms like Facebook, YouTube, Instagram, and gynecologists can also join us on WhatsApp for daily discussions on cases they deal with in OPD. And this is the initiative of Dr. Neeraj Yadav sir. And here we also share clinical material. So, love and intimacy, two words that touch the deepest corners of the human soul. Love connects hearts, intimacy connects minds, emotions, and vulnerabilities. But what truly happens within us when we fall in love? Why do some bonds feel safe and healing while others leave us anxious or distant? The psychology of love and intimacy helps us understand how the brain releases dopamine and oxytocin, how attachment styles shape closeness, why vulnerability strengthens connection, and why fear sometimes builds walls instead of bridges. Love is not just a romance. It is emotional safety, it is trust without fear, it is being seen and still being accepted. A few lines, that is, इश्क सिर्फ हाथों को थाम लेना नहीं होता, इश्क दिल के राज समझ लेना होता है, नजदीकियां फासलों से नहीं नापते, रिश्तों को एहसास से बांधना होता है. So it says like intimacy is not merely physical closeness, it is emotional transparency. It is saying this is who I truly I am and hearing and I'm not leaving. Psychology teaches us that love flourishes where communication is honest, boundaries are respected, and emotions are validated and vulnerability is welcomed, not judged. Because when love is understood psychologically, it becomes conscious, healthy, and deeply fulfilling. Today, let us explore not only how to love, but how to wisely love and safely and wholeheartedly. So, welcome to this enriching journey into the psychology of love and intimacy. First of all, in this session, I would like to welcome our Dr. Neeraj Yadav sir for his points of first.
Yeah, so thank you everyone. Special thank to Dr. Manoj Pandey sir for being the today's chief faculty for and giving his thought about sharing his thoughts about the psychology behind the love. Sama, you said that with love there should be some meaning or something like that. But I think love is a crazy thing. You don't think anything else when you fall in love. It's you don't understand anything. You just fall in love. So there is nothing. I don't know, sir. We will be very eager to hear from Manoj sir how we fall in love. What is the basic psychology behind it? But basically, love is a just craziness, according to me. So with that, on the eve of the Valentine's Day, I welcome everyone. Happy Valentine week or happy Valentine Day to everyone.
Thank you, sir.
We have few interesting sections before Manoj sir's speech, sir. We have here Dr. Varija ma'am with a poetic beginning of this session. Dr. Varija ma'am, please go ahead.
Thank you, Neeraj sir, for giving me this opportunity. Actually, I am into writing. Whenever I feel I have some time, I do write few lines about any weird things. So one of things I shared with Neeraj sir, and he appreciated it. So here I am to recite with you one of my poems on love. It says, प्रेम में बहकना जरूरी तो नहीं, प्रेम में बहकना जरूरी तो नहीं, शरीर का भूगोल पढ़ना जरूरी तो नहीं, उसके शाने पर सर रखकर सोए सारी रात और उसकी धड़कनों को सुने, ये जरूरी तो नहीं. प्रेम रूह का है मिलन एहसासों का, विचारों का भी हो मिलन, ये जरूरी तो नहीं. दूसरी बरसात में भी कभी महकती है मिट्टी, दूसरी बरसात में भी कभी महकती है मिट्टी, हो सदियों से सूखी ये जरूरी तो नहीं। और मैंने देखा है मैखाने में तड़पते प्यासों को, मैंने देखा है मैखाने में तड़पते प्यासों को, हर किसी की हो तलब पूरी ये जरूरी तो नहीं। थोड़ी फिक्र, थोड़ा अपनापन साकी का, थोड़ी फिक्र, थोड़ा अपनापन साकी का, वो पैमाने ही छलकते ये जरूरी तो नहीं। और प्रेम की खुशबू से, जैसा सर ने कहा कि इट जस्ट हैपन्स, यू जस्ट फॉल इन लव, तो प्रेम की खुशबू से खुद को ही महका लेना, हो जमाने को सब खबर ये जरूरी तो नहीं। और क्षमा को देखकर, क्षमा जी आपके लिए, क्षमा को देखकर जीते भी हैं कुछ परवाने, हर किसी परवाने को जलकर मर जाना हो ये जरूरी तो नहीं। थैंक यू।
Superb,
वाह
ma'am.
वाह वाह,
Ah, wow.
खूबसूरत.
Thank you so
थैंक
much.
यू।
Another interesting session. I welcome Dr. Tripti Saran ma'am for her way to express about love and intimacy in connection with mythology, about love from Radha's perspective.
Thank you, Shama. I must thank Neeraj for inviting me with this unique idea of, bringing mythology in the midst of the week that is being celebrated for love. After all, Radha Krishna is not just a love story, it is the love story. And Radha Krishna are unique. Their story is neither the typical love story nor it is the kind you come across in mythology. If you look at the female protagonists, the goddesses, they have kind of always made me full of intrigue. They are given different roles, like Goddess Durga is given power, Saraswati ji is given knowledge, Lakshmi ji is given wealth. But ultimately, they are worshipped as creators of the world, as mothers, a role in which we worship. Now, here, Radha is presents a very different facet of womanhood. She is a Balsakhi. She plays with God, she sings to God, she dances with God, she dresses up to look beautiful to him. She is torn by jealousy, she cribs, she clings, she fights with him, and then she makes up passionately. She leaves her house in the middle of the night to meet him by the riverside. So she's always an eternal lover. She's never the wife, she's never the mother. And that is what drew me to Radha. Their union, Radha Krishna's union, is not socially acceptable, yet they are worshipped in temples. Even in those, conservative and orthodox times, forget about these modern times, they have always been worshipped. She's older to Krishna. She is, some say, engaged to somebody else, married to somebody else, yet she chose to defy societal norms and love another man. She displays her love openly. She's totally abandoned in love. But then later she gives him up very easily. So how can you love somebody so openly, so brazenly, with her intensity, and then you let go so easily? This got me thinking, at least a 21st century woman would think. Now, does this have some metaphysical meaning? Was it? I mean, I tried to read between the lines. So I started reading up literature on Radha. Now, she is not mentioned in any of the major texts such as Ramayana, Mahabharata, Bhagavad Gita. They barely talk about Radha. Her first recognition, you can forget the smaller religious texts which are highly conflicting, but her first recognition comes in Geet Govindam, which was written by Jayadev in the 12th century. Now, this depicts Krishna as an eternal lover, madly and forever in love with Radha, who is reciprocating his love in equal measure. They brought Shringar Ras to Bhakti Ras. And it stormed the imagination of people in those times, and Radha Krishna became the much adored divine couple. And people were taken in by the idea of God as an eternal lover who's tragically not united with his love, Radha. So now, not much is known about what happens to Radha when what happens to Radha when Krishna leaves Mathura. And there is a lot of discrepancy in the different narrations. In all probability, her role in his life is complete, and Krishna now focuses in energy on far more important events. Now, there's a lot of debate on whether Radha is a myth or a reality. Well, the definition between these two terms gets very blurred in a world that believes in logic and evidence. And it is only faith that will restore clarity. Now, reality can never be tampered with, but it is mythology which has rich metaphors that allows one the freedom of interpretation. You can read Radha Krishna as a man woman, as god goddesses, the eternal couple, or you can take them as a union of devotion with divinity. She is a medium to realize Krishna. When she sneaks out of her house at midnight to meet Krishna by the riverside, it is said that this can be a metaphor of people rising above their social responsibility and uniting with God. But despite all the metaphors and all the variation, what strikes you is the story of a simple village girl who steals the heart of God. At places, she comes as a philosopher. I read a lot. And at places, she comes as a poet. At places, a woman deeply in love, pinning for him, craving for him. And at places, she, is comes across as a friend, sometimes scolding him for all his adventures that he does in Gokul and Vrindavan, at places going along with him in doing these adventures. And later on, she comes as a very mature woman holding on to his love even as he leaves for Mathura. So she symbolizes love and longing, love and desire, which is otherwise not mentioned in our spiritual text. And above all, she symbolizes patience in love, the eternal wait. It is said that Radha is still waiting for Krishna to come and take her. So, though in another narration says that in true sense, she's a soul of Krishna. You don't get married to your soul. So, that is why Radha and Krishna are never married. She's just the soul of Krishna, and together they become whole. So, there are a lot of unanswered questions, lot of gaps in our understanding of this eternal prayer. But Radha is, I believe, the more that I read about her, is very contemporary. She is fascinating and she's actually enthralling. So, if you permit, I would like to read out a few verses. Neeraj sir, can I do that?
Yeah, sure.
So this is my book is divided into portions when Radha was Krishna and Radha was born, before they met, and then in Gokul, then in Vrindavan, then later when Krishna leaves, and ultimately when she unites with his soul. So I will just take out a few. I won't take much time. So you were born on a dark, rainy night. A snake shadowed you all the way. I too was born on a stormy night, cradled in a pink lotus, gathered in its sweet fragrance, its dainty petals hiding me away. Radha was not born the natural way. She was discovered in a petal. And a toddler when a storm took my mother away. Not another set of parents. Not everyone is lucky. But I don't complain, Krishna. My Barsana is no less than Gokul. You might be Yashoda ka Kana, but I shall always be Barsana ki Radha, Ladli Radha Rani. We have other names too, Devki Nandan, Madhav, Radhika. But do you know which I love most? It is when we are called Radha Krishna. You the name, I the meaning. In this evolving universe, you are my intangible presence, Krishna. So a few more. So this is about them celebrating their love when they are in Vrindavan. I love it when you say there is no one in my life but Radha. I love you even more when you say my flute plays only for Radha. How easily I fall under your spell, believe all that you say. Every day you enchant a little more, Krishna. Your curly locks left open, never braided, untamed, tied to a waist, so rakish, unreined. But then your pitambar with pink hues gels so beautifully with my red blues. Life is sometimes finding beauty in contrast, just like you and me, Krishna. There are some days that are rainy and some nights that are stormy, but then never a day too long, neither a night too short when you are with me. The bright stars or that lazy moon, the feel in the air, a sunny horizon or a grey overcast. Oh, what doesn't remind me of you, Krishna? My stepmother locked me in tonight, but your flute beckons, it's a full moon night. Your Radha is captive, but there is a window and Radha is inventive. Balram, Lalita, Kulika, Sudama, and all my Ashtasakhis are partners in crime, sneaking out on a full moon night, dancing to the rhythm of divine Krishna. This is about when Radha is Krishna is leaving for Mathura. I may not be a princess, I may not have been born with a purpose like yours, but we shall stay united in my dreams, in my heart. We are all warriors, you are not the only one. Not every war is won or lost, neither is every war fought. Some battles you lose to win a war, you and me shall never be lost, Krishna. Your flute, leave it behind, your breath, leave it with mine. Intermingled, we shall stay alive, Krishna. Krishna sends Uddhav to talk to Gopis and Radha when he leaves for Mathura. So she says, you sent Uddhav with your Pitambar and your Vajanti Mala. He comes in ignorance. He knows not. You are my deliverance. He carries your message. But for Radha, you are the message, Krishna. He asks us to stop pinning for you, to take you out of our heart, that we should forget lest our pain affect and draw you back. But it wasn't, but how can we pull away from the one who is our universe? It wasn't just you who left that day, it was our hearts too. And it was neither Akrur who took you away, it was the dream in your eyes, Krishna. She says that sometimes life is just a changing perspective. Ayan is Radha's husband. Ayan becomes me and I become you. Is that why I behave the way I do? Together yet detached, distant but attached. Everything is relative, only you are absolute. You are my sun and sunshine. But are we just a perspective, Krishna? Somebody's wife? Am I your paramour? I don't know and I won't care anymore. I the devotion, you the divinity. You are God, yet I struggle for my identity. I love red. Red is the color of divinity. Red is also the color of seduction, Krishna. I think that's enough. I don't want to drag on.
Thank you.
And
Thank you. Thank you. It was such a beautiful description about Radha's love. And I think it's a very unique thing about Krishna and Radha, because all other gods, you say the male part is always first, like Ram, Sita, Shankar, Parvati, but only Radha is first and then Krishna. So it's
yes,
something different and unique.
it is said that Krishna blessed Radha, that everyone will say her name even though she doesn't get married to him and he goes on to live with his wives and all. That कहते हैं ना, बरसाने की एक एक घास में भी राधा राधा बोलते हैं. It is always Radhe Radhe. It will be before Krishna.
Thank you.
And they have a very sweet story. I always believe it is more than simple story. It is the love story. As I say, it is not just any love story, and it has a more metaphysical meaning. Than it is about your conscience, your soul. It is something like that. I mean, I can go on and on, but I thought I don't want to take the time of Dr. Manoj.
Thank you. Thank you so much, ma'am. Now I want to hand over session to Dr. Sonia Anand, ma'am. Please introduce our chief guest, chief speaker.
Thank you, Dr. Shama. And it is my honor and privilege to introduce Dr. Manoj Pandey. Sir is having an impressive bio. Sir is a clinical psychologist, and he's bearing MPhil and PhD degrees. And at present, Sir is holding the position of professor and head of the Department of Clinical Psychology at Postgraduate Institute of Behavioral and Medical Sciences, Raipur, Chhattisgarh. And he's having more than 13 years of teaching and training experiences in MPhil clinical psychology research and patient care too. And Sir is associated with Rehabilitation Council of India as visiting expert and accessor of RCI approved institution in all over India. And Sir is the member of many national and international journal committees as editor and reviewer. And I'm naming a few, and like Indian Journal of Social Psychiatry, Indian Journal of Clinical Psychiatry, Indian Journal of Psychosocial Health, to name a few. And Sir has got a lot of professional association with many societies. He's the vice president of Clinical Psychology Society of India, and he is the fellow of different acclaimed societies all over the India. And sir is in the panel of many examination boards for MPhil and PhD degrees, and like the Department of Clinical Psychology at NIMHANS Bangalore, and same at the Manipal University and MIT University at Noida, to name a few. And sir is an active academician, and there's a lot of publication in his name. A few are like Lifestyle as Medicine, The Science of Healthy Living. And there are many articles in the leading newspapers like The Hindu and Times of India. And he has chaired as speaker and presenter in many national and international conferences. And with this superlative impressive bio, I invite Sir to kindly show some light on the sensitive topic of psychology of love and intimacy. The mic is all yours, Sir, and over to you.
Thank you. Thank you so much, Sonia, madam. And I am literally grateful to Neeraj Yadav, sir, for giving this opportunity along with the other team members. Sama ma'am is there. And the sexual health ki Pathshala, the whole team of sexual health ki Pathshala, I literally thanks them for giving this opportunity to me on a very interesting topic which has a great role in our all of us life. And I am literally astonished by the description of Radha and Krishna love by Tripti Sharan madam, and literally she has been working hard in that, and that's why the all the details about the different, because different events in their love story, and she has presented few of them. And if we come to today's topic and discuss it more, I would little bit again connect myself with what she has spoken. Actually, the Krishna and Radha, that part of story has not been yet publicized in Indian society. If we look at, if we compare Lord Rama and Lord Krishna, Lord Rama is given more, if we look at the importance and priorities in different sectors of transfer of the history, or in comparison to Krishna. Even if the Krishna and Radha is considered, they are prayed as a god, but the love story part has been hidden from the main discourse. That the same thing ma'am was also saying. And there could be the social insecurity about the love, and the expression of it in a very that kind of manner. That may be one of the reason behind that part of their whole life is not that much exposed to us. That is the reason ma'am is also finding the difficulty to collect the information about their love story especially. And she has spoken that a lot. And if I look at love, I would say that we can look at it at three levels. One, we talk about the couple, basically where the intimacy and sexual component also comes. And parent-child love, that is also one aspect of the love, and there the feelings are different, the purpose is different, but the kind of sense of deep connection between the two individuals. Here I am saying parent and child, can be mother and father anyway, any one of them. And then the love between the disciple, or rather bhakta or bhagwan ke beech mein love, that I would say Meera is one of the very topmost example of that kind of love. And she started singing the song in love of Krishna. And we know the history of, she has been in Rajgharana mein thi, aur wahan se bahar aakar ke, that was the effect of the love. And she has written a lot and sang a lot about the love, especially uh, towards the Krishna. So if we look at the dimensions of the love, one side it appears a couple related romantic love, another side it is appearing a kind of spiritual inclination. If you talk about the Miraj love, and then the parent child uh, love that we call Vatsalya. If we look into our own Indian literature, तो वात्सल्य का कोई इंग्लिश में शायद मुझे नहीं लगता है कि कोई टर्म होगा जो वात्सल्य को उस तरीके से एक्सप्लेन कर पाए. तो that is the beginning note of what the love has been. But today we will try to explore a little bit more about love. Especially, we have been discussing about the psychology of it. I would bring the neurobiology also in between, because without involvement of the neurobiology or nervous system, the love, the defining love and understanding love and intimacy, and the risk factor why the love and intimacy doesn't grow, in a healthy manner, why there are reservations in experience of the love and intimacy, even in a couple relationship, or the basically we'll focus here majority portion on the couple relationship. In context will be the same. And because the population, the gynecologists, we are the audience, so we would reach to the end of the discussion and this conversation by the tips of practical issues, and we will discuss about how it is affected, its experience and expression is affected. Let me share my screen, and I will request that to help me to know whether the screen is visible or not. Sir, screen is visible?
Yes, sir. Yes, sir.
Hello?
Yes, sir.
Visible.
It is visible.
Okay, okay.
Yes, sir.
Yes. And it is moving to?
Yes,
It is
sir.
moving?
It's moving, sir.
Okay. Thank you. Thank you so much, ma'am. So, we are going to cover basically the neurobiology of love, neurobiology of intimacy, and attachment. We will understand what is attachment. In layman language, we all would be knowing it. Rather than knowing, we would be feeling it, experiencing it in our day-to-day life. So the attachment is considered the blueprint of love and intimacy. That also we'll discuss. And we will discuss some of the adverse life events, how, especially when we talk about the trauma. Here I am talking about the psychological trauma, that we will discuss how the psychological trauma alters our brain and hamper the experience of love and intimacy to nurture naturally. And it not only hamper that, but also hamper the expression of it, uh, the inter-individual interaction also. So that also we will discuss. And finally we will come to the clinical implication of whatever we have been we will be talking about, and red flags when we need to refer the case, and when we need to look into this individual require the psychological or psychiatric help, not only the gynecological help. That also we will understand. Now, before I move to the other things, at first we will try to understand what is psychology. Basically, psychology is a scientific study of the behavior, emotion, thoughts, and mental processes. When the psychology was established as a branch of the science, at that time the initial definition came into, like, it is a scientific study of mental processes. Then different definition came, but the last finally definition which was accepted was that it is a study of the behavior. But the thoughts, emotions, and mental processes comes into the behavior of different realm of individual experience. So what uh, is psychology? Basically is help us how people think, how they feel, how they behave, how they relate to each other, how biologically, socially, and cultural aspects influence this thinking, feeling, and behaving. And not only how, but it goes beyond that also. So here, for understanding in nutshell, that is suffice. In simple, psychology try to study why we act the way we act, the why we feel the way we feel. So now, little one slide on love. It is basically has been described by ma'am also, but we will look into it. It is a deep emotional bond characterized by the care and affection, attachment, commitment, emotional investment, and desire for the closeness. And we will come to know these terms in coming slides also. From the psychological perspective, love is can be divided into three sections to understand it. At emotional component, if we understand, the warmth and care remain the more core to the emotional component, and cognitive component, thinking about person and valuing them. And obviously it happens, we become kind of obsessive uh, when we are in love with someone. So that is the thinking component. We keep on thinking about the person, the things associated with the person, the gestures, the postures, or many other things also. That cognitive component covers that. And the behavioral component, the act of care, sacrifice, and protection, which are very important foundation of human relations also. And these are the behavioral component of the love that we all go through, we all experience, we have been receiving, and we have been giving to other individual. So we would be better able to relate to what we have been discussing here. Then we come to the third slice of intimacy. If we look at it, what is intimacy? Emotional closeness and psychological connection. In nutshell, if we try to define it, it would look like
मतलब
this.
बहुत मोटे तो नहीं है, ठीक ठीक है, बहुत पतले भी नहीं है, जैसे 70 year old वाले को.
Then if we look into the component of the intimacy, what happens in it? We, when we feel intimate to someone, we feel free to share the thoughts and feeling. We have the feeling of understood in that intimacy, intimate relationship, trust and vulnerability. We try to trust the person, or we trust the person, not try, rather trust the person, and we become vulnerable to the individual. We surrender to the individual, and we have that sense of trust which help us to surrender to the individual. Even that moves into the very intimate physical relations as well as the other things also. And then the other component, emotional safety. These are interconnected. If we look, if we see the association, correlation between these components, they all together make this term which we call intimacy. And if we look into the different kind of intimacies which we come across with in the couple life, emotional intimacy, where we share the emotionally, very core to heart thing to the person whom we are intimate. And intellectual intimacy, we share the intellectually curious, rich ideas, wisdom, and all lot of other things. Spiritual intimacy, one of the important aspects of intimacy, which is lacking, not lacking, but we should also be equally given importance in the couple relationship, because WHO also defined the health, including the spiritual component in it. That has revised the definition by the WHO, and definitely physical intimacy, we are all aware about it. Then I can be my true self with you without fear. So that is the sense of intimacy, basically gist of what we feel in intimacy. And then this topic, is interconnected with the different areas or the science, basically psychology, medicine, relationship, and human biology. So we will cover the neurobiological aspects of love, intimacy, and attachment. We cannot think of love and intimacy without attachment. So psychologically, what attachment is, we will understand, and how the attachment, foundations are hampered by the adverse life events in the human growth and development. That also we'll try to understand. And basically, why it is important to know for the gynecologists to, in the practice, who are in the academics of practice. Basically, it helps us to communicate better, being informed about the sense of safety, about the female coming to your clinic. And because the individual doesn't come with the medical issues or gynecological issue, the person visit to the clinic as a whole, and the repertory of the experiences of the individual in the past determine the experience of the individual in the clinic. So that's why if we are informed about those insecurities which hampers the love and intimacy, and can be one of the source of the problem in their sexual life, in their other things we will discuss in coming slide. Now, if we look into the neurobiology of love, love is just not a feeling; it is a neurochemical event. If we look through this lens, then ventral stratum, amygdala, and hypothalamus appears to be the main location of the brain, and which are related with the reward system, stress arousal system, and bonding hormones. Basically, hypothalamus is a center of emotion and motivation, and oxytocin and vasopressin has also a great role to play in love and intimacy. And dopamine, how it is, how these three chemicals, you know, played the role in love, we will discuss in coming slide. But for for now, these chemicals are secreted in the brain, in the other parts of the body when we are in love. And that's why that feeling of love, that feeling in love appears to be a kind of unique because of involvement of these neurochemicals. Now we look into the role of the thought, the role of the emotions, the role of the neurobiology. If we look at it scientifically, they are all interconnected. We have been created by the nature as a whole, and if there is any problem in any of these systems that hampers the overall experience, then let me talk about the dopamine at first. The chemistry of desires. Basically, it is prevalent in the areas of brain like ventral tegmental areas, nucleus accumbens, and the prefrontal cortex, which is visible in the pictures also. Now, these areas are, and these areas through the dopamine are connected, or are responsible for excitement, motivation, craving, and obsession like thinking. When we talk about the obsession like thinking, the prefrontal cortex has a great role to play here. And this is why the early romantic love looks like sleeplessness, constant thoughts, emotional highs and lows. So, dopamine play a key role. Clinically, this explains why the married people often report intense sexual desire, because this chemical, exchange or chemical things are happening in the brain. And then norepinephrine, if we look into, is responsible for increased heart rate, focused attention, and memory enhancement. And that's why we see the people in love remember the small details, dates, and conversations because of these particular neurotransmitters, along with the other things that help it in this process. Clinically, this explains why the married people often report intense sexual desire. Again, the same thing is being repeated. The third thing is serotonin. The level of serotonin decreases when the person is in love, and low serotonin in early love lead to obsessional thinking and repetitive thoughts. So basically, here we are saying obsessive thinking. It is not clinical OCD feature kind of, which will be defined differently, but a repetitive, consistent thought about something, and in love, about the love partner. That's why we have the repeated thinking about the person when we are in the love, in early love. But when we become accustomed to live with the individual as a part of daily life, somewhere that love goes down. We can think of, discuss about why it happens. We will take this during the question answer session. Now, so that is the role of the serotonin and oxytocin. I think all individuals are medical professionals. They would be aware about all these hormones. But I thought that let I cover and make a base to understand this holistically. So this oxytocin is understood a bonding molecule basically, and hypothalamus and pituitary remain one of the location in the brain where it is predominantly released. And basically what happens when the oxytocin is released, it creates the trust, emotional closeness, and long term bonding. That's why hugging, kissing are that much pleasurable when we are intimate romantic relationship. And breastfeeding for the mother uh, create the similar kind of effect, right? So that's why kissing, hugging has that much role in intimate relationship. And we without thinking of doing it, we come into it, we act it because our neurobiology says to act it. And why it is important for the gynecologist: pregnancy, postpartum bonding, and breastfeed counseling. For these things, the oxytocin will play a role, and we can suggest how to, release this hormones more using, the kind of touch sensation in our day-to-day activities, especially during the pregnancy. And we know that we have the uh, historical story of Abhimanyu, Abhimanyu, when he was in the womb, and he heard the things, and that's why he was able to break that what we call, I'm not getting the exact word. So there also uh, these had role to play. And now if I move into the intimacy, neurobiology of intimacy, what happens in the brain, how it is associated, uh, and what are the component involved in it. If we look into it, the parasympathetic nervous system get activate when we are in intimacy. Vagus nerve regulation, which provide the overall generalized relaxation for the nervous systems, and reduction in cortisol. Obviously, cortisol is a stress hormone, and reduction of it also provide a kind of uh, relaxation to the overactivated nervous system. And increase in oxytocin, we have also understood the oxytocin role in previous slides. So basically, these are the four component which play a role in terms of the neurobiology of intimacy. Now, attachment. Basically, we will try to understand psychological aspects of attachment also in coming slide. It is a blueprint of love, intimacy, and kind of feelings. It is not only psychological in nature, but it is brain-based survival system. And the human life experiences, whether that is the emotional abuse, that is the sexual abuse, that is the physical abuse, that is the verbal abuse, that is the neglect by the parent or by the caregiver, that is the rejection of the demand by the parents and caregiver during the developmental phase are very important for the disruption of this blueprint of love and intimacy. Basically, that's why uh, the trauma which we will be discussing in coming slide or kind of experiences, even the simple neglect when the child is coming to us with a kind of curiosity and we are busy with our own chores, and if we do not give importance to what the child is saying, it create a kind of sense of neglect and rejection in the brain of the child. If it repeated repeats frequently, it has the impact upon the functions as well as the structure of the brain when the child is developing, when the human being is developing till the age of 16. These affects, these hampers the to create the strong attachment base. So what happens, what the brain areas are involved in it? Amygdala is very important for threat and safety detection. And that's why when the individuals who are insecure inside, see, feeling of insecurity is not only psychological, it is hidden in the brain of the individual also. So amygdala get overactivated in those individuals, and the threat sense of threat and safety detection remain one of the core function of their psychology and neurobiology. If the person has gone through kind of adverse experiences in the developmental period, the attachment base is hampered through the role of the amygdala. Similarly, prefrontal cortex, because many time in human life, the experiences are stressful, especially during the developmental period, and the situations, those stressful trauma related situations remain such where the person cannot escape from the situation also. The individual has to goes through that trouble again and again, and that hampers the individual's capacity of emotion regulation and trust building, which are basically regulated by the prefrontal area of the human cortex. And anterior cingulate, basically rejection sensitivity and social pain, they represent these two things. And hippocampus, we all aware about, it has a great role to play in memory generation and consolidation of the memory. And here when any kind of attachment related problems occur, the memory of the relationship also hampers somewhere in the brain of the individual. Even becoming adult, the person doesn't recollect those things in terms of the thoughts and idea, but the nervous system, even not using those ideas in the brain of the individual, but the nervous system react to the current relationships also. If we talk about the intimate relationships also, so our intimate relationship, our sense and capacity to be loved and to love and to be intimacy and to act in it depends upon these all aspects. And then if we look into the coming slide, we will discuss about the psychological aspects of the attachment style. Although these terms has been long talked and studied in psychology and psychiatry since a longer period of time, more than 70 80 years, I think before that also, but they becomes relevant today also and will remain relevant in coming time. So what happens, attachment styles are basically defined and discussed by these three terms: secure, anxious, and avoidant attachment style. We will try to understand what these terms are, how they affect the person's behavior and experience in intimate relationships, and how they are affecting the individuals and couples and females behavior and experience when they visit our clinic. How a person who have the insecure, rather anxious and avoidant attachment style develop as a part of the developmental process, how affecting the clinic visit, the clinic behavior, as well as the intimate, we will discuss that. So at first we will discuss about the secure attachment. What this is? Basically, comfortableness with the closeness, ability to trust past partner easily, emotional expressiveness, feeling safe in relationship. Again, we will feel this, we will have this. The person who is having, who has developed this secure attachment style as a part of the development and growth will have these abilities in the individual's psychology and nervous system, because the sense of safety, the sense of connection, the sense of attention, the sense of given attention by the another person in the relationship play a basic role for development of the secure attachment and intimacy outcome. What happens when our attachment style, the attachment patterns in us is secure, sexual satisfaction remain better. They are open for the communication, healthy desires and stable bonding, because they are not living in a sense of insecurity, they are not living in a sense of fear, anxiety, because of, not because of the their how they are relating currently, because how they have been reared as a person and what kind of events has happened in their life, again determine this sense of secure attachment. Why secure attachment helps clinically? uh, when the patients come to us, many patients you have seen, they do not discuss their their complaints very openly. They hesitate, they have a lot of speculation in mind. If they say something, then I think the doctor, because doctor are being considered as a god in Indian cultural setup. So uh, the secure attachment helps them to express themselves openly and follow the treatment advice and cooperate as couples and recover faster. So high compliance and low drama will be there in the individuals who are having the secure attachment. And when the patients are not able to express themselves, to tell their problem accurately, and not accurately means the way they are expressing, if you see that the patient is not able to communicate, you may think of, okay, the individual has not been in a secure attachment style majority of the time. So then our behavior, we can be little more engaging with the individual, that all other things what we can inculcate out of this talk we will discuss at the end. And then anxious attachment style. What are the characteristics of the anxious attachment style? Fear of rejection, constant reassurance seeking, overthinking about the partner's behavior, emotional highs and lows. And this, intimacy outcome, clinginess. Clinginess is one of the things that is coming out of the anxious attachment style. And sexual insecurity, performance anxiety, and jealousy. These can be the outcome if you talk about the intimate relationships of the attachment, anxious attachment. And common complaint, low libido, pain during intercourse, infertility related stress may be high in those individuals if they are going through the condition. Frequent clinic visit will be there because of this particular attachment style they have developed in them, and repeated doubts despite the normal reports. So that kind of individual, if you see, yeah, the one area of your brain should be asking yourself, okay, whether this individual may be having their attachment issues. And underlying issue, emotional insecurity and not pathology. So this is not a completely true statement which is given So both are important, pathology and emotional insecurity. And then we talk about the avoidant attachment style. What are the characteristics of the avoidant attachment style? Emotionally distance. They try to be distant from the individual in relationships, difficulty in express feeling, overthinking about partner's behavior, and over dependent in some time. Uh, and intimacy outcomes, low sexual expression, reduced desire, mechanical intercourse, and avoidance of the emotional connection. These individuals often appear fine, but the partner complain about their emotional coldness because they are not anxious as such, but their past relationship experiences has created a neural circuit in the brain and the similar kind of neural network in the psychology of the individual that they try to avoid the relationship. They have not developed that sense of trust in the relationship because of the kind of adverse event they go through in their life. And now, this I think we have discussed in the previous slides also. Now, how do the life experiences alter the brain attachment and consequently love and intimacy? That we are going to see in coming slides. What is trauma? I have already discussed a little bit about it. Trauma can be defined again as an unpleasant experience in human relationship, or it can be not only the relationship but also some adverse events has happened in the life of the individual that also create the trauma. And uh, what are the things, if we just pinpoint some of the important cause of the trauma: the childhood abuse and neglect, sexual abuse, interpersonal violence, medical trauma. Being diagnosed with the infertility can be a medical trauma for a woman. And if the woman has insecure or anxious attachment style, the woman may be more reactive to or exceptionally distrustful towards the diagnosis made by the gynecologist. So then repeated and relational traumas within the attachment relationship. So even the minute neglect, if it is not a kind of abuse, can create the traumatic experience. So many attachment problems, many problems are the attachment problems and not medical problems as such. uh, Especially the way the problems are expressed, if we not only the medical problem but the expression and experience of the problem is also colored by the how the individual's life has been. So problem here is the disconnection, not the hormone. If we talk about the trauma, then what happens in the brain when the individual goes through such kind of experiences? Amygdala hyperactivity is responsible for threat, which we have seen earlier also, safety and threat related things. And because of the trauma, the overactivity or hyperactivity of the amygdala, the fear and hypervigilance remain one of the psychological feature in the individual who have gone through the trauma. Hippocampus volume uh, get reduced out of the experience if it is repeated in nature. Then what happens out of that? The contextualizing safety is harder for them because the experience, and as a result of the experience, the hippocampus volume and prefrontal cortex, we have discussed that HPA axis, we all are aware, uh, get dysregulated, and the secretion of the cortisol remain disproportionately high and create the hypo or hyperactivity, freeze or fight or flight kind of response. And then uh, disturb release of the oxytocin. is also, create the problem with the trust and bonding. So these are the primary impact of the trauma in the brain of the human being. And the research say that childhood traumas are associated with SP axis disruptions and altered limbic prefrontal circuits. And uh, if we look into the gynecological issues, the PTSD and trauma are correlated with the poor sexual functioning and high rates of genitopelvic pain. So then, because of this altered process, how the altered neurobiology changes the intimacy experience. Again, hypervigilance, perceiving the intimate touch as threat. Even the cognitively, the person, suppose the individual is going toward the intimate relationship first time. If we talk about a sexual relationship first time, and individual has had this traumatic experiences in the life, especially in sexual trauma in nature, and the touch sensation would not be pleasing for the individual, it will be threatening, not because of the current experience the individual is going through, but the loading has happened, or loading of the past experiences that make the person hyper vigilant. And the small touch also becomes a kind of threat, a startle response, and pain amplification would be high. Whenever we are hyper aroused uh, in our nervous system, our pain sensitivity get altered, our pain threshold becomes quite low. Then emotional dysregulation, intense fear of abandonment and withdrawal can be the experience in the intimate relationship. Memory, inability to conceptualize the sexual, safe sexual and womb experiences, especially in the married woman, and re-experiencing during the pelvic exam and labor. Re-experiencing of what? Re-experiencing of the traumatic, feeling or traumatic events that has happened in their life. So pelvic exam and labor can also activate those memories and context. And then chronic stress because of the cortisol changes, SP axis, and reduced libido and menstrual dysregularities or irregularities can also be, think of in this way. And yes, so we have seen these things. Now practical and concrete step for the audience. Basically, when we try to summarize the outcome or understanding about these things, universal respectful screening can be opted. Brief trauma sensitive questions can be asked, especially about the emotional life of the individual also, not only the problem they are coming with. Along with the problem of gynecological nature, they come with anxiety, they come with stress, and the individual's stress and anxiety severity many times or mostly is defined by their attachment bond inside their brain and their mind. And before the any pelvic examination, explain the steps, take the permission. Asking the permission remain very much important in the trauma informed care, not only in psychiatric care, but also I think it must be incorporated by all the branches of the medicine. And we do that formally, we take the consent formally, we do all other things. But when we are examining for small steps also, if we take a permission for the individual, can I move ahead, are you okay, these kind of things, create the reassurance for the individual. Even the individual has gone through the traumatic experiences, but the experience of examination here is happening differently. How? Because the individual is seeking consent, seeking permission, and seeing the individual's comfortableness and then moving ahead. And calm, predictable environment, warm tone, explain the instrument, minimize the surprise, and these can be, the inputs which we can incorporate while practice. Use the patient control, basically allow self positioning and self-administered speculum when feasible can be one of the implication of this trauma informed understanding and its application, and minimize re-traumatization. uh, discuss before touching, avoid unnecessary exposure, and then document sensitively, note the trauma history. कुछ तो पूछ सकते हैं उनसे कि क्या कुछ इस तरह की घटनाएं हुई, और if we do not directly jump into that, we can say a few questions like how do you feel emotionally, and how you react emotionally, whether you feel secure, safe inside you, how you have been feeling. The kind of initial conversation can be started, and we need to avoid to dig the trauma history because that re-traumatize the individual again. We can take the events, we can talk about if the individual is okay to talk about the trauma history. Otherwise, we can discuss about their sense of emotional regulation currently and move ahead with the needful. When to refer, when you see that the patients have the feeling of dissociation, especially the numbness in the body parts which are not explained by the medical regions, and that numbness is the cause of one of the symptoms or one of the spectrum of PTSD, post traumatic stress disorder. And if the individual has the flashbacks, if the individual have overreactive emotional expression, at that time we can think of a referral before any pelvic exam that we have discussed already. I think it is a repetition. And whenever you feel that the individual's emotional apparatus, especially the attachment related phenomena, and that will be seen or observed by us through over anxiety, over stress by the individual, the kind of expression by them during the clinical interview. By that time also we can think of the individual may have these issues, and if the individual is ready for that, can be referred for clinical psychologist or the psychiatrist for the holistic management. And that helps in multiple phases during the treatment process. And that is what I would like to end here, and we are reaching around 8. So, and back to you, Neeraj sir.
Yes, sir. Yes, it's a very informative session, sir. We come to know so many things about the psychological part of the love and attachment. Neetu, is there any question in chat box? Neetu?
So we have two questions. I'm just pasting it here.
Yes.
Okay. Sony, you can just in chat box, there will be question. You can just put up to the sir. Yes, Apurva, you are latecomer. You want to say anything?
How does
So, sir, before we start, my sincere apologies because I was in a another webinar and I have a talk. And Manoj sir, I'm a big fan of yours. I always used to say this, and the topic what you have taken and going, but I can't believe that anybody can correlate the love and the intimacy from the medical so strongly. So thank you so much, sir. It is really a wonderful to always being as any audience and see and watch your lectures, sir. Thank you so much, sir. Yeah.
Thank you so much, sir.
Sir, before we, sir, Neeraj sir, with your
Yes,
due
yes.
respect, should I ask one question?
Yeah,
Definitely.
question of the audience, na? Then we can ask. There are two questions from the audience. Just we will finish that and then you can go
Absolutely,
ahead.
sir. Yes, sir.
Yes, Sony.
Neetu, please send me the questions, please.
It is in chat box. You can just
Share in
put
the
I
chat
am
box.
able to see. I am able to see the questions. There are two questions. One is, how does the childhood abandonment feeling affect them in their love relationship? Okay. And then, how do you identify when intimacy issues are secondary to depression versus primary
Primary.
relational conflict?
I'm unable to see.
I am not able to understand it. How do you identify when the intimacy issues are secondary to depression versus
Sir,
primary?
the thing is
is
that, sir,
basically due to depression
After
or
the
it is a primary
it
factor.
is a result or outcome of depression. When
Okay,
the
okay, okay.
intimacy is the outcome
Hmm.
of depression,
Yes,
the
yes.
question
The
means that.
both the questions are quite relevant. So I would like to address the first question at first. How the childhood abandonment feeling affect them in their love relationship. So as I have discussed earlier also, whatever we are today in terms of the age, in terms of the experience accumulation, in terms of our degree, in terms of whatever the spectrum of life we are involved in different things. But inside us, we are the human being who have developed through a kind of track of experiences.
Mhm.
And the whole psychiatry and psychology and that science says that the initial life experiences represent your overall uh, determining factor that will determine your way of experiencing the current life and expressing the current emotional state. Mm. So many times people say that I don't want to get angry, but I get angry. Mm.
Mhm.
So basically, consciously, the person is, hating the anger and having the shame and guilt inside because of the anger, but the individual is not having the control upon it. So it means the neurobiology is shaped in such a way that the individual doesn't have the conscious control upon the anger. That is one example why I am saying about the anger, because it is mostly experience emotion by all of us. The same thing happens when you feel insecure during the developmental period. Those imprints are deeply, in our remain in our brain, especially the subcortical systems, which doesn't have. Basically, we are the cortical animals. We do a lot of
Mm.
things through the cortex.
We have a evolved cortex. You mean to
Yes,
say, sir?
evolved, the most evolved cortex. But
Yeah.
we are the animal also
Mhm.
at the subcortical level. The
Mhm.
subcortical levels of us are very important to regulate our life, especially if we talk about the heart rate, breathing, and all other things. And limbic system remain there, which plays a major role, which we have discussed earlier also. So
Sir,
abandon,
I would
हाँ
like to
मैम
ask how we treat
मैम
this.
इस क्वेश्चन को मैं, हाँ, थोड़ा सा
Hmm.
मैं एक बार
हाँ जी सर.
कर लूँ, उसके बाद में तो the kind of childhood experiences of abandonment create a kind of imprints in our brain.
Mhm.
That imprints remain there. If the child has been abused, if the child has gone through the adverse life experiences, that
Mhm.
experiences are encoded deeply in the brain as well as the psyche of the individual. And
Mhm.
even if the individual becomes, adult in age wise, but
Mhm.
the individual's imprints remain the same. And that's why if we talk about the requirement in the love relationship, the requirement is of mutual trust, the requirement is of mutual caring, the requirement is of expression of the things openly. But how can it happen? If the imprints have been hampered,
Mhm.
and the imprints which are not in our conscious control, because जो भी हमने अभी discuss किया, whether we talk about the impact on the amygdala or other portions of the brain,
Mhm.
their effect remain there, and that colors our perception of the current life also. if our experience has been that kind of, our current love and romantic relationship also will be affecting. तो ये पहले क्वेश्चन का आंसर है. दूसरे क्वेश्चन का आंसर ये है कि कैसे आप डिफ्रेंशिएट कर पाओगे कि ये रिलेशनल कॉन्फ्लिक्ट की वजह से है या फिर डिप्रेशन की वजह से है. तो बेसिकली इफ वी टॉक अबाउट द डिप्रेशन can be understood as a separate entity of illness where the primary feature remain feeling sadness, lack of pleasure, और एनर्जी की कमी महसूस होती है, कुछ करने का मन नहीं करता है, नॉट एबल टू कॉन्सेंट्रेट. दीज आर द classical symptom of depression. As a part of the depression, the intimacy issues also may appear in the individual, क्योंकि वहां पे लोगों से बातचीत करने का मन नहीं कर रहा होता है इंडिविजुअल का, because the individual doesn't feel that much motivated inside because of the sad feeling, because of the guilt, because of the shame hidden inside. The individual will have the intimacy issue. अब यहाँ पे primary problem intimacy की नहीं है. The individual is not going through an intimate relationship or not playing a key role or what is expected, not because of the relational conflict, but because of the depression here. The reason for the depression may be different. The other side, but again, if we look at it little deeper, dig deeper, depression, stress, anxiety are highly prevalent in the individual who have attachment insecurities as a part of their developmental period. जिनमें भी ट्रॉमा एब्यूज के एक्सपीरियंसेस से जो भी व्यक्ति एज ए चाइल्डहुड और एडोलेसेंट एज में बढ़ रहे होते हैं, उनमें साइकियाट्रिक मोर्बिडिटी की संख्या चांसेस काफी ज्यादा रहते हैं. अब ये दूसरे क्वेश्चन का आंसर. तो we will have to take the history and little bit if we are interested in involving these things in our practice, we need to inquire about the individual, about the kind of experiences the individual has gone through, using non-sensitive kind of questionnaires. And if the people are interested, I may request Jadhav sir that we can have a practical orientation talk also about this aspect if it is needed by the crowd. I am very happy for that if that is the and कैसे ठीक करते हैं. मैडम ने क्वेश्चन पूछा कि हम ठीक कैसे करेंगे. ठीक करने के लिए एक तो साइकियाट्रिक मेडिसिन्स हैं, काउंसलिंग, साइकोथेरेपी प्ले ए की रोल अलोंग विद द मेडिसिन, और मेंटल हेल्थ के जितने भी इश्यूज हैं वो एक होलिस्टिक अप्रोच से ही ठीक हो पाते हैं. काउंसलिंग ऑल्सो रिमेन की रोल and medicine also plays the key role because the mind and brain both are involved here. And because we cannot separate the hardware from the software, right? Yes. So that's why, and nowadays there are different systems in psychotherapy and counseling also. Some of the systems only focus upon reduction in the symptoms of stress, anxiety, depression. Some systems are there which try to restructure the experience of the individual which has been traumatic earlier, but now if we take the individual in the similar kind of scenario, whether making the same kind of situation or even not pinpointing that particular event, restructuring of the experience, taking the individual in similar kind of state can recreate the neural network in the brain. The sense of insecurity get down a lot in severity. Using especially few of the therapies are very famous nowadays. EMDR, eye movement, EMDR का नाम सुना होगा आपने. And along with that, some emotion focused therapies are there. One new system is developing in the West since last 40 years. It has come to India now, which is called internal family system. And I am getting trained in that particular system. इसमें क्या है कि हम उस ट्रॉमेटिक इवेंट के बारे में बिना बात किए भी अभी ही उस व्यक्ति को ये रियलाइज करा सकते हैं by interviewing, by taking the individual deep into the experience of the sense of self, and उसको एक न्यू पर्सपेक्टिव दे सकते हैं, and through that the rewiring happens in the brain. The disconnections which has happened as a part of adverse life experiences, the individual get again reconnected, and the sense of safety, security increases after these treatment processes. तो बेसिकली ये साइकोथेरेपी के प्रोसेस से होता है, एंड मेडिसिन हेल्प if we unroot the trauma, then the probability of getting into relapse also get down a lot into the psychiatric other illnesses. तो इस तरह से हम कर सकते हैं. If we are not expert in that area, the simple thing which we can incorporate a kind of mutual trust for the client, being little bit sensitive towards the emotional reactions of the client, and our questioning would not only depends upon what we are trying to ask the patient, rather how the patient is reacting to us. If we can involve that in our clinical practice, even if we are not healing those, but at least we are making a sense of security there and then when the patient is visiting to us. So that way we can create a safe environment and provide the patient to express freely, which is a kind of experience with them. Ultimately, what will happen? It will, enhance the therapeutic alliance and doctor-patient relationship, and the kind of exchange remain key to any clinical care. And that way we can incorporate the outcome of these, ma'am.
Okay, sir. Dr. Purva, he would like to ask some question. You are asking some questions, sir.
Yeah. Manoj sir, actually this question is probably a old question, and in this questions I and Neeraj sir always a bit of not agree with each other. Sir, what I always feel, if relationship of a partner outside bedroom is not good, so how we experience that the inside bedroom it is good. You understand, sir? है ना?
Yes.
And Neeraj sir many times said, no, Apoorv, this can't be. Many times the husband and wife has fight like cat and dog, but on the bed they are rock. So I just want from you, sir, because we are talking about the love and intimacy. So I just want from you, what's your insight into that?
हाँ, तो बड़ा अच्छा इंटरेस्टिंग क्वेश्चन है. मतलब आंसर देने वाले को भी इंटरेस्ट आने लगा है उस क्वेश्चन का आंसर. तो बात ये है कि it is absolutely true that if the relationship outside the bed, अब मैं किसका फेवर ले रहा हूँ किसका नहीं ले रहा हूँ ये पता नहीं है मुझे, whether I am talking in favor of Neeraj sir or in favor of Apurva sir, but which is the fact, I will express that only. So outside, if the relationship outside the bed is not good, obviously the sexual experiences would not be that much enriching in nature, because the connection will not be whole. It will be a part connection. Maybe it is basically केवल एक sexual pleasure एक की रोल प्ले कर सकता है वहां पे, जो आपने अभी थोड़ी देर बोला कि बेड से बाहर तो अच्छे नहीं होते हैं बट रॉक करते हैं बेड में. तो वो बात तब सही हो सकती है जब दोनों कपल्स का प्राइमरी मोटिव टू गेट द सेक्सुअल प्लेजर है, राइट? एंड that can be more acceptable in living relationships especially, or a kind of salt transactions. But when we talk about the married life and when we are living a longer period of time for together as a intimate and partner, so at that time many time, especially in the females, because the male neurobiology is little bit different. जो सर ने बोला कि बाहर तो मतलब अच्छा रिलेशन नहीं भी है, लेकिन मेल कैन बी having the kind of enjoyment in the sexual intimacy also, even outside of the relationship, of the bed they had the issues. But about the female, if you talk about, the female sexuality is little different than the male sexuality, because the female required the kind of security, sense of connection, sense of love, sense of being noticed,
Security.
sense of being touched, sense of being, involved in a good kind of foreplay, which male usually doesn't prefer. ठीक है, तो हालांकि मतलब पूरा सत्य किसी के लिए भी नहीं है, तो इट इज अ काइंड ऑफ मतलब कैन बी पॉसिबल इफ both individuals are aimed at a particular thing, then it is okay. But otherwise, if we look in a longer relationships, the kind of relationship outside the bed also hampers, and many times the vaginismus issues, the pain issues in the female are the outcome of the relational dissatisfaction. एंड अब डिससेटिस्फेक्शन के बहुत सारे रीजंस हो सकते हैं। अगर हम रीजंस को डिस्कस करें तो बहुत उसमें समझ जाएगा, बहुत सारे रीजंस हो सकते हैं उनके बीच का। तो ये मेरा आंसर रहेगा अपूर्वा सर आपके क्वेश्चंस के रिस्पांस में। आई होप आई कुड लिटिल बिट ट्राई टू टच द क्वेश्चन। यस मैम,
बात कर रहे हैं। हाँ मैम, कीर्ति बोल रही हूँ मैम, ये आपके पास में परसों आई थी ना।
हाँ सर, मुझे बस आई जस्ट वन क्वेश्चन फॉर यू, because nowadays in movie the one-sided love is so much highlighted and given so much importance. So is there, from the psychological point of view, what is one-sided love? Is there anything like that?
Sir, one-sided love, a kind of, yes, definitely it exists, especially मतलब एडोलेसेंट एज में इसका प्रिविलेंस ज्यादा देखने को मिलता है हमको, लेकिन जैसे जैसे हम ग्रो होते हैं तो शायद वी आर मतलब इन रैशनल इन थॉट, बट इमोशंस तो शायद वन साइडेड लव के लिए तब भी आगे बढ़ते हैं, बट हम एक्सप्रेस वन साइडेड तब बोलेंगे जब हम फील कर रहे हैं, हम एक्सप्रेस नहीं कर रहे हैं, इनफैचुएशन काइंड ऑफ।
But तो love is always unilateral or it's all should be always bilateral or mutual?
सर देखिए दोनों तरीके से हो सकता है सर लव, ठीक है।
Okay.
अगर हम लव को फिर अगेन इफ यू आर लुकिंग द लव थ्रू द मतलब दिस एंगल ऑफ इंटीमेट रिलेशनशिप, तब बात अलग है, तब दोनों का इन्वॉल्वमेंट होने की जरूरत है, तभी वो दोनों तराजू सही से चलेंगे, ठीक है। बहुत बार क्या होता है कि एक तराजू मतलब one person is blind for the another individual and but the another individual doesn't have the feeling. यहाँ पे भी हमारा अटैचमेंट इंटरफिनिंग का बड़ा रोल है। अब उतने डीप में हम नहीं जाएंगे अभी, तो कहने का मतलब ये है कि यस इट कैन बी पॉसिबल सर।
Or one more question, sir. You can fall in love only once, or it can be happen multiple times. What psychology says?
It can happen multiple times, sir.
Okay. And with one person or too many person also, you can be in love at same time.
साइकोलॉजी अब देखिए इस बारे में मैं बिना साइंटिफिक एविडेंस के बहुत ज्यादा आंसर नहीं देना चाहूंगा इस चीज का। आई वुड कम बैक विद द आंसर फॉर इट। अगर हम वैसे देखें कि मतलब बेसिकली पॉसिबल तो है कुछ भी।
अच्छा,
ह्यूमन ब्रेन इज वेरी कॉम्प्लेक्स।
हाँ, इसलिए पॉसिबल है बिकॉज अगेन जो मैंने अभी अटैचमेंट बॉन्ड्स के बारे में बात करी थी, अटैचमेंट ब्लूप्रिंट के बारे में बात करी थी, दैट डिटरमाइन द inclination of the individual towards the individual opposite gender also। और बाकी उसके अलावा जैसे बहुत बार क्या होता है कि if an individual has been traumatized as a child, as an adolescent, the characteristics of the perpetrator also get internalized in the individual, ठीक है। और कभी कभार जब ये डीपली इस तरह से इंडिविजुअल अफेक्टेड होता है, दैट ऑल्सो कम इनटू द लव काइंड ऑफ रिलेशनशिप्स ऑल्सो। और बहुत बार क्या होता है कि इसकी वजह से भी कुछ पर्सनालिटी डिसऑर्डर्स हैं जिसमें फ्रीक्वेंट इस तरह की चीजें देखने को मिलेंगी जो आपने बोला, जैसे बॉर्डरलाइन पर्सनालिटी डिसऑर्डर है, हिस्ट्रोनिक पर्सनालिटी डिसऑर्डर है, तो वहां पे इस तरह के मल्टीपल इंस्टेंसेस देखने को मिलेंगे। तो दैट इज एक्सट्रीम सिवियरिटी ऑफ द साइकियाट्रिक इश्यूज, अगेन because of the change brain circuit, because of the kind of adverse experiences in the life। तो ये रिस्पॉन्स रहेगा सर आपके क्वेश्चन का।
Sir, there is a one sentence na in sexual medicine ke men give love to get sex and women give sex to get love. So how according to psychology love is different for men and women perceived by both? It's same or
हाँ,
different?
सी फीमेल बाय नेचर बाय मतलब द built up and by the evolution has more depth in their sense of being and sense of living. मैं मेल हूं लेकिन फिर भी मैं फीमेल के बारे में मतलब अप्रिशिएट कर रहा हूं इस चीज को लेकर के कि दैट इज द मदर काइंड ऑफ यू नो दो
नेचर,
एस्पेक्ट
गिविंग
है।
नेचर।
हाँ, तो वो उनमें रहता है। और मेल में भी ऐसा नहीं है, जैसे हम भगवान शिव के बारे में अगर हम देखें तो अर्धनारीश्वर बोलते हैं। तो इसका मतलब क्या है कि if you talk about the neurotransmitters also, all the neurotransmitters are there in, all the hormones are there in, you know, उनके मतलब लेवल्स में कमी ज्यादा देखने को मिल सकती है। सिमिलर काइंड ऑफ द फीलिंग्स ऑल्सो वी हैव द सिमिलर। जैसे वात्सल्य की बात अगर कही हम थोड़ी देर मतलब शुरुआत में हमने, तो वात्सल्य की फीलिंग फादर में भी सिमिलर होती है एंड मदर में भी सिमिलर होती है। ठीक है, अभी सिमिलर उसमें एक्सपीरियंसेस में डिफरेंसेस हो सकते हैं, उनके एक्सप्रेशन में डिफरेंसेस हो सकते हैं, बट दे वुड कोरिलेट समवेयर एंड तो सिमिलर काइंड ऑफ थिंग्स इज देयर इन द लव एंड इंटीमेसी आल्सो। सर आपका पिन पॉइंटेड क्वेश्चन क्या था, मैं उसको फिर से एक बार एड्रेस करूंगा तो हाँ।
How men and women see love? They see same, or it is same for both of them, or it is different as a perspective from psychology?
हाँ, again it depends upon the person, sir, their
Okay.
history, sir, their history, right, their script of adulthood. So that way both the things can happen because kind of बट मेल में फिर भी हम देखें तो सेक्सुअल इंक्लिनेशन रिलेटिवली फीमेल की तुलना में थोड़ा सा ज्यादा देखने को मिल सकता है अगर हम मतलब ओवरऑल देखें। और बाकी तो फीमेल बहुत सारे बैठे हैं, तो यहाँ पे हमारे बात को काउंटर भी कर सकते हैं तो दैट डिफरेंट पर्सपेक्टिव अबाउट इट। तो दैट इज व्हाट आई वांटेड टू सर। यस।
And regarding sir Gen Z, is there any difference in their attachment pattern from the previous generation or?
Yes, definitely, sir. Definitely. Because in this era, the parenting has become a challenge. Because, you know, in this era, in this, you know, decade or last 2 decades, 3 decades, 4 decades, अभी करंट के बारे में बात करें तो जो पेरेंटिंग एक चैलेंजिंग इश्यू है, और जेन जी के लिए बहुत बेसिक उनका अटैचमेंट का जो बॉन्ड है वो स्क्रीन से हो रहा है आजकल बहुत ज्यादा। एंड देयर अंडरस्टैंडिंग अबाउट देयर सेल्फ इज you know rooted in the peer orientation. They are guided by the peers. अगर हम एडोलेसेंट और जेन जी के बारे में बात करें तो अगर पेरेंट्स ने कुछ बात बोली और पेयर ग्रुप ने कुछ बात बोली तो दे विल गिव प्रायोरिटी टू द पीयर ग्रुप थिंग्स एट फर्स्ट। इवन बाद में जब हम और कन्वर्सेशन करते हैं तो उससे ये पता चलता है कि विच इज लॉजिकल इन नेचर। अगर हम अगेन अटैचमेंट के बारे में बात करें, रिलेशनशिप के बारे में बात करें पेरेंट चाइल्ड के, तो पेरेंट चाइल्ड रिलेशनशिप ऐसा है जिसमें कि पेरेंट्स का रोल एक अपर हैंड के रूप में है।
I mean just loving relation, not
yes,
parent-child
loving,
relationship.
हाँ, yes, definitely, and तो
boy and girl.
yes, yes, तो उसमें क्या होता है कि अनकंडीशनल होता है। फादर और पेरेंट्स की तरफ से बच्चे के लिए जो बिहेवियर है दैट इज अनकंडीशनल इन नेचर। ठीक है, बट अगर हम पीयर ओरिएंटेशन में जाते हैं दैट गेट चेंज्ड, वहां कुछ भी अनकंडीशनल नहीं होता। पीयर रिलेशनशिप में कंडीशनल चीजें होती हैं। तो उनके अंदर एक इस तरह का सिस्टम डेवलप हो रहा है कि पेरेंटिंग बिकमिंग चैलेंजिंग इश्यू नाउअडेज because of the peer orientation, because of the involvement of the digital technology. We see a lot of cases of family discord because of the overuse of the smartphone by the children. उसमें 10 साल से लेकर के 16-17 साल तक के बच्चे को देखते हुए आए हैं हम अभी। तो इस तरह से भी चैलेंजिंग है। और बाकी द एक्सेस टू द वर्चुअल वर्ल्ड is very problematic for the growing kids. वहां से उनको एक्सपोजर ऑफ द थिंग्स स्पेशली द सेक्सुअल कंटेंट they get exposed to it before the age, before they have the neural,
they lose their innocence, sir, early.
yes,
They lose their
yes,
innocence.
yes, before they have the neural and psychological maturity inside them, बिफोर दैट द कंटेंट कम्स। एक कल ही में एक केस आया था, वो बोला कि जब मैं फर्स्ट क्लास में था तो उस समय ही मुझे फर्स्ट टाइम पॉर्न का एक्सपोजर करा दिया मेरे से 10 साल बड़े बच्चे ने। ठीक है, तो बोला कि मेरे दिमाग में वो चीजें एकदम मतलब फ्लैशबैक के रूप में आती थी एंड इट वाज ए काइंड ऑफ मिक्स फीलिंग फॉर मी एट दैट टाइम व्हेन आई वाज ट्राइंग टू नो द ट्रॉमाज ऑफ द इंडिविजुअल। तो वो बोला कि मिक्स फीलिंग क्या थी, अच्छा भी लग रहा था बट डर भी लग रहा था, फियर ऑफ अननोन और फियर ऑफ काइंड ऑफ थिंग भी था। और बाद में दैट इंडिविजुअल गेट सो मच ऑब्सेस्ड विद द सेक्सुअल फीलिंग एंड एक्ट एंड has been involved in masturbation very frequently, has been involved in porn watching pathologically, 7 to 8 hours of porn watching in 24 hour। तो ये एक थोड़ा सा अलग सा केस है, एक्सट्रीम केस है, बट इसके कैरेक्टरिस्टिक्स और जेनजी लोगों में भी देखने को मिलते हैं। तो दैट्स व्हाई द पेरेंटिंग बिकमिंग लिटिल चैलेंज। वी कैन नॉट अवॉइड देम कंप्लीटली, stop them from the exposure to the virtual
world. We
have
to watch them, sir. We have to watch them what they are watching.
उसके लिए बेस्ट तरीका यही है कि अगर सपोज 10 साल से नीचे का बच्चा है, हाँ नहीं, मैं सजेस्ट करता हूँ को विविंग, उसको देखने दें जो भी कंटेंट वो देखना चाह रहा है, बट उसके साथ हम बैठ करके देखें। ठीक है, अगर हम रेगुलरली ऐसा करते हैं तो दैट बिकम्स अ पैटर्न एंड धीरे धीरे वो पार्ट ऑफ बिहेवियर हो जाता है। हम ऐसा ही कर रहे हैं। मेरी एक बच्ची है 6 साल की है, तो जो भी हम देखते हैं, वो जो भी देखना चाहती है वो अपना देखती है, मैं भी वहां पे बैठा रहता हूँ, वाइफ बैठती है। एंड बिकॉज वी नीड टू बी लिटिल कॉशियस अबाउट, we cannot know what content is popping out from which
that is the main concern, sir. There are many explicit things which pops up on the screen in between.
Yes. तो और दूसरा पेरेंट्स के लिए मेरा हमेशा ये सुझाव रहता है, आई रिमेम्बर वन ऑफ द टॉक इन निमेंस एंड द सेम थिंग केम टू माय माइंड एट दैट टाइम आल्सो। तो मैं पेरेंट्स को ये सजेशन देता हूँ, बी कॉशियस ऑफ योर porn behaviors also. Many times what happens that the parents see the porn, forget to remove that page. ठीक है, ऐसे केसेस हुए हैं जिसमें कि फर्स्ट एक्सपोजर फादर या मदर के सेलफोन से ही बच्चे को मिलता है। तो वी नीड टू बी लिटिल कॉशियस ऑफ आवर ओन बिहेवियर्स आल्सो। तो वो सब चीजों को अगर हम प्रिवेंट करें तो शायद वी वुड बी हेल्पिंग द चाइल्डहुड टू ग्रो स्मूथली। तो यही मेरा रिस्पॉन्स रहेगा। और इसके अलावा कोई क्वेरीज है तो यस सर।
थैंक यू सर। नेक्स्ट सर की Minister Gi, you are giving vote of thanks now.
Where is she?
Good evening, everyone. Good evening, everyone. A heartfelt thanks to Dr. Manoj sir for his insight talk on the psychology of love and intimacy. Gratitude to Dr. Sikri Sharan for beautiful presenting love from Radha's perspective. And special thanks to Dr. Wajira for the soulful ghazal that touched our hearts. As a sincere appreciation of Dr. Soni for grateful introduction, and thank you SexMed Connect team, Dr. Neeraj Yadav sir, Dr. Apurva Datta sir, and Dr. Sama Sultana madam. And thank you audience.
And Neetu, you want to show you something? Neetu, are you there?
Yes, sir, I'm there.
Yeah. You want to show something now? AI.
Sir, since it's already 8:40, I will take just 5 minutes to introduce you to something new. Thank you for the opportunity, sir. So, actually, Medisage e-learning platform has newly launched an AI tool called Sage AI only for doctors, which is available on our Medisage app itself. So, as you all know, AI is trending nowadays. So, we have developed an AI tool exclusively for doctors. It is very different from normal AI tools like ChatGPT or Perplexity that's available in the market, and it's generative AI. But we have developed an agentic AI which can be a partner and agent to a doctor as well. So since we have partnered with Google Medallion, the data you will get from Sage AI is more medically accurate and authenticate. So I would like to show you the features, some of the features of Sage AI. Let me share my screen once. Hope my screen is visible.
Yes.
Yeah. So these are some of the features that you will get in the Sage AI, which is absolutely free to use for all the app users. Okay, one is AI search. You can search about any kind of medical related information like latest guidelines in management of hypertension or thyroid, etc. from here. Due to time constriction, I'm not showing the entire demo, but you can explore it yourself. The second is diagnosis support. This is an interesting feature where you can enter the age, gender, and patient history, like what patient is facing, any kind of symptoms. You can even add any kind of reports over here, like ECG reports, blood reports, X-rays, and then you can just click on submit. What happens is you will get a diagnosis according to the symptoms you have entered, like high probability, medium probability, and low probability. The high probability will be the most appropriate diagnosis, then there will be medium probability, and then there will be low probability. So that is how this diagnosis support works. And the third one is drug dosage. If we're entering a drug name and entering the condition of the patient, like in pregnancy phase or in lactating phase, or the patient has kidney issues, and you're choosing the patient type itself, you can get the dosage, like for that drug, how much dosage is safer for that patient. So this is another feature that we have, drug dosages. And there is drug to drug interaction. Many drugs do have contraindications when given together. So if you place two of the drug names, drug 1 and drug 2, and check their interaction, this AI tool will give you major contraindications or medium or low contraindications between the two drugs. Another very useful tool for the doctors. And another feature is deep research. If a doctor really wants to publish a journal or research papers, they can enter that topic and collect authenticate information using this feature itself. Like there is no need of going through thousands of research papers all by yourself, which is very time consuming. This tool can really help you with deep researching regarding any topic, medical topic. And then another feature that you get in the Sage AI tool is create presentations, which is very helpful for academically oriented doctors, and we are very happy to introduce this new feature here. You can describe the topic, about what topic you want to create the presentation for. You can select the number of slides, you can select the language also, and target audience, like you want the presentation for medical professionals or students or for patients. And then what will be the tonality of presentation? Is it academic oriented, is it conversational, or professional? And then just click on additional PDF document or any written document. You can just submit over here, and then after clicking on submit, slides will be created for you, up to 15 to 20 slides. So these are the Power Pack Sage AI we are bringing to doctors, and since it's free to use, I would really appreciate and request all the faculty members and our audience to start using the Sage AI and give us your valuable feedback. for the same. Just to end, I would really like to say that AI is never going to replace doctors. It will be just an assistant to doctors to help make better patient outcomes. So that's all from my end. Any review or opinion regarding our future, it's most welcome.
Neetu, is it available in all the language or only few languages? You can make the slide or PDF.
Sir, it's available currently in English, Hindi, or Marathi only.
Okay.
Yeah. So English is most preferred by many of the doctors that we have interacted to, and we have been presenting our work of in many of the conferences like napcon, epicon, rssdi, and cardiology conference. Tomorrow we are going for diabetology conferences also in. So doctors are really giving overwhelming responses to our AI, especially this diagnosis support and deep research is appreciated by doctors. So I wanted your reviews also. Which of the feature is best liked by you?
Sure,
So
sure.
yeah.
Thank you.
Actually, I have used already one of your feature, that is making PowerPoint presentation of 20 pages. I tried with cervical cancer presentation, and it with no time it took, and it has given me the complete slide to slide, and it is asking much more effective also. Also, that I have clicked that, and it has made a very good slide.
Yeah,
And I can download.
that's why. Yeah, that's why I was asking. It should be available in more languages. You can,
Okay.
because
Sure, sir. I will take your considerations. We are working on it. According to our view, this is very primitive for us. We want to be more advanced in this, and we're trying our best. We will be more advanced when we get more feedback from doctors like you after using it. So yeah, we will always welcome your feedback, sir, ma'am.
Thank you.
Thank you. Thank you so much for your time.
yes. So thank you, Manoj sir, and
Thank
Sony, Sama, Kriti, Apurva, everyone, and of course Medisage for today's session. Good night, everyone.
Thank you,
Good
sir.
night.
Thank you so much,
Good night.
sir,
Thank you
and
so much, Manoj
team.
sir.
Thank you for the invitation. And फ्यूचर में भी अगर कुछ इस
Yes,
तरह का
yes.
टॉपिक रहता है तो आई वुड बी वेरी हैप्पी टू बी देयर.
हम आपको छोड़ने वाले नहीं है सर.
हम आपको छोड़ने वाले नहीं है.
सर ने क्विकली कलर कोऑर्डिनेट भी कर लिया, रेड शर्ट पहन के आगे. दैट वाज वंडरफुल.
मैं अपने वही रूम में था तो मुझे मतलब टी शर्ट दिखा, हालांकि रेड नहीं है, बट मैंने कहा ओके इट विल मैच.
दैट इज वंडरफुल सर, दैट इज वंडरफुल.
और मैं हमेशा अलग ही चलता हूँ.
तू आ गया वही बोल.
लेट भी चलता हूँ.
ठीक है. थैंक यू एवरीवन.
ऑल राइट सर, थैंक यू सो मच एंड
Thank you so much.
थैंक यू.
थैंक यू सर.
Thank you. Good night.
Bye.